Hello and welcome. You're watching NDTV. I'm Rishika Barua. India is reporting a record daily rise in COVID-19 infections. There are rapidly spreading new variant strains of COVID-19 that we're all hearing about. There are lockdown-like situations in several parts of the country once again. To make sense of this deadly second wave of COVID-19 and to answer all your questions, we have Dr. Randeep Guleria, the head of the All India Institute of Medical Sciences, joining us. Thank you, Dr. Guleria, for sparing the time. We understand that you're very busy these days, but over 2 lakh daily cases in India. Why is India seeing this record-breaking daily surge?
So the situation is very grim, and we will see a rise in cases in the coming few days or weeks. And I think we need to really look at 2 factors. One factor is that, like we've been saying, people felt that COVID was over in January, February. There was no COVID appropriate behavior. There was large crowds, parties, which we still continue to see. And I think along with that, the virus also sort of became smarter. It changed itself and became more infectious with the mutant strains. And that led to a very rapid rise in the number of cases. If you look at the curve, the steepness of the curve is something which is frightening, because it has really got a lot of healthcare sectors unaware, and people are just scrambling to have more beds, more oxygen points, because the curve has risen at such a sharp manner that from an area where you were thinking that COVID is over and now a lot of COVID facilities were literally shut down, you've had to restart them in a very short period of time. So I think it's more related to both our own behavior and also the change in the virus in terms of it becoming more infectious.
All right. So human behavior and behavior of virus both are responsible for that steep curve that we're seeing. But, you know, the double mutation, the UK variant, other strains are prevalent in India. This is something that the Health Ministry has made official. But just how prevalent they are is something we don't know just yet, Dr. Guleria. Are these new strains more deadly?
So you're right, we don't have data as yet, because we need to really have data which is looking at the mutant and the clinico-epidemiological profile. So if you are saying that you have a mutant which is now prevalent in a particular area, what is its clinical application? Is it causing more severe disease? Is it causing more number of cases? Is it causing an escape phenomena that people are getting reinfection? Or is it causing a decrease in the efficacy of the virus? That data needs to be there. We know that there are mutants circulating. We know that they are becoming more and more prevalent in certain areas. There is indirect evidence which suggests that wherever you have these mutants circulating, the cases have dramatically increased. So I would say that there is indirect evidence which suggests that the change in the virus, the mutation, is leading to the spike in the number of cases. But how is it going? Is it really having an effect in terms of the severity of disease and in terms of the immune escape mechanism? We urgently need more data, because that will have a big implication in terms of treatment strategy and on the vaccination.
All right. But is treatment strategy being affected if we don't know which mutation the patient is being infected with?
No, I don't think so. The treatment strategy continues to be the same. The drugs that we're using are the same drugs, because remember, it is still a coronavirus. Right. And we still have the same phase of having a phase of viremia followed by a cytokine storm. And the treatment strategy for both of them in terms of antiviral drugs, in terms of steroids, and in terms of anticoagulant is the same.
Yes.
But I would just like to highlight here that we need to have a structured treatment protocol rather than having a panic reaction and really giving every drug to every individual on day one.
Okay. I think that's a very important point that you make as well. Now, you know, the LANCET Commission has recommended that gatherings of more than 10 people should be banned in India for a period of 2 months. You know, that goes to show just how much they are expecting the cases to rise. But my question to you is, how do we do that, Dr. Guleria? Is lockdown the only option left?
So currently we are in a really grim situation, because the number of cases are really rising rapidly. It's causing a huge strain on the healthcare system. And I can, when I talk to my colleagues, I can really look at the frustration that they're having, because they're really overstretched. They've been working hard for 1 year. They've been really, you know, given up their holidays, given up everything. And they're having to face this brunt because of lack of people having COVID appropriate behavior. The health system can only work to that much. Unless you decrease the number of cases by taking aggressive action, the health system will not be able to absorb the huge number of cases that you're going to get. And this is creating a huge problem on the healthcare workers. Therefore, you have to decrease the crowds, you have to decrease the gatherings that you're seeing, because like I said, this virus is more infectious. It is going to travel much more rapidly in the air and infect more and more people. And if you allow crowds to happen, you are going to have more cases in the coming few weeks.
All right. I want to just shift our focus now to some of the most commonly asked questions as far as this second wave is concerned. What are the new symptoms, Dr. Guleria, that are being seen currently in the country?
So by and large, symptoms are same, but there are two new things. One is younger people are getting affected more than what we had seen in the past. This includes children also. So the fact that we were thinking that children may not get infected is something that we need to be vigilant about, and therefore they should be tested if they have also symptoms. The other thing that we're seeing, which is that a lot of patients are coming with GI symptoms, with just diarrhea, nausea, vomiting, fatigue and body aches, more than what we were seeing last time. That is also something that we're seeing. But the other symptoms in terms of cold, cough, pain in the throat are still the prevalent common symptoms.
All right. As far as testing is concerned, can the RT-PCR test detect the new strain, the mutant strains of COVID-19, and is a false negative possible?
Yes. So I think it's very important to understand how the RT-PCR test works. And there are two or three things that are very important. One is, what is the sensitivity and the specificity of the test? We know that this test can pick up only 80% of individuals. You still will have people who may be RT-PCR negative but may have COVID. And therefore, you have to rely on clinico-radiological parameters also if you have a person who is RT-PCR negative. Secondly, it depends on how the test has been done. I've seen that very often, sometimes because of the discomfort that the putting the swab into the nostril creates, many people don't really put the nostril all the way deep down, and you don't get enough material on the swab to pick up the virus, and therefore it may be a false negative.
Right.
Having said that, current data which has been accumulated by WHO looking at by ICMR looking at the kits that we have suggests that if the test is properly done, the current RT-PCR test will pick up all the mutant strains which are circulating in India. We need to continue to be vigilant because, like I said, we have to keep on being ahead of the virus, and this virus is rapidly is mutating as we go along.
Sticking to testing, because that's really a burning issue right now, there are several symptomatic patients who are testing COVID negative. When should they get a retest if they have symptoms? And if they are awaiting test reports, we've seen a lot of symptomatic patients either not having access to immediate RT-PCR testing, or the reports are getting delayed. Should they just begin treatment?
So this is a very important question, and we had this question also 6 months ago. Two parts in this. One is, if you have symptoms which are suggestive of COVID infection, you must isolate yourself, even while you're waiting for the reports. And we know that there are certain areas where the report may take more than 24 hours. So rather than saying that I'm waiting for the report and go out and sort of go to a party or have a get together, that is something we should not do. While you're waiting for a report, presume you are positive and isolate yourself. Secondly, if you have a report which is negative, you should repeat it after 24 hours if you have the symptoms. At the same time, get your other tests done, which could be the blood test, looking at your inflammatory markers. If there is a doubt, you may even get a CT scan done and look at the whole picture. If it is suggestive of COVID infection, you must start treatment. It's better to be on the safer side. Most drugs are safe as far as the early part of the disease is concerned. The problem happens when you go to a more severe disease, when you have to start giving steroids, drugs like remdesivir, or even other stronger drugs in a hospital setting. That becomes a challenge, but I think sometimes you have to discuss this with the patient, take a risk-benefit analysis, and if the risk of infection is high, you must treat this patient even if the RT-PCR is negative.
Okay, so I think what you're giving is very practical advice. If your report is negative and you have symptoms, you should repeat the test. If the test is delayed and you're awaiting a result, you must absolutely isolate, and importantly, follow it up with a blood test or a CT scan, because those are other indicators that can in fact tell you about COVID. Now, the Lancet has also said, Dr. Guleria, that there is more and more evidence to suggest that COVID predominantly spreads through the air. How can we protect ourselves?
Correct. So, if you remember, this is a debate which has been going on almost for 8-9 months.
Yes.
Droplet infection versus aerosol infection. What it means is that we were saying that predominantly the infection is droplet, but to some extent it may be aerosol. The difference between the two is important to understand. When we talk of droplet, we're talking of particles which are more than 5 microns in size. They cannot really go to a long distance. They drop quickly to surfaces, and therefore the whole issue of maintaining a distance of 2 meters and wearing masks was more important. Aerosols are those particles which are less than this in size, and they can travel longer distances. So therefore that means that even if a person is coughed in a room and then he has left the room, the virus may still be there in the air and someone may get the infection. Therefore, the point that we have to understand is that your room should be very well ventilated. There should be good cross ventilation. Better to not have crowds or meetings in a closed room, because even if one person is infected, it's not that if you're sitting, let's say 10 meters away from an individual who is positive, you cannot get infected, because the aerosol can travel a longer distance, and if someone coughs or sneezes, it can even be much longer, and therefore in an enclosed environment, you have to have good ventilation. I would say in summer, you must open all your windows and let good fresh air come in, have good cross ventilation.
All right. So ventilation is key, and you're saying that we are currently more worried about aerosols than we are about surfaces. Is double masking therefore something that you recommend, and should wearing double mask be made mandatory, given the fact that there are many experts who are saying that the new strain is so virulent that one mask can't save you?
So the issue is, what type of mask are you wearing? If you're wearing an N95 mask, it is usually effective. Some people would wear a surgical mask on top of that if they're going into an area where there is a high chance of exposure. Doctors do that when they go into an ICU, and then take out the outer surgical mask and dispose it, and they continue wearing the inner mask. If you're wearing a cloth mask, then it's important that you may consider a double mask, because the filtration of a cloth mask is not as good as an N95 mask. So if you're wearing a surgical mask also, and you're going in an area which is crowded, better to wear 2 surgical masks. But if you're having an N95 on its own, if it's well worn, is good enough. But again, I would like to just mention 2 things. One is, make sure that the mask is properly covering and forms a seal around your nose and mouth. A lot of people just wear a mask, but a lot of air goes in from the side of their nose, or from the side of their cheek, or from the chin area. That is of no use. So the mask should be such that when you take a deep breath in, the mask actually moves in. That means you're sucking air in through the mask rather than air coming in from the side of the mask. Right. So your mask has to be worn properly so that it forms a tight seal around your nose and mouth.
I think that's an important indicator, that the mask should actually move when you're breathing. That goes to show that you're actually breathing through the mask. So one N95 is good enough, or if you are wearing a cloth mask, then perhaps 2 masks is what is recommended. Now, the mutant strains of COVID, Dr. Guleria, are they causing an increased lung involvement? Many doctors are talking about this right now. And therefore, the question that a lot of our viewers have asked is, should all patients who test positive for COVID get a lung scan?
So I don't think so that everyone should get a lung scan. So let me put it in another manner. We know that 15% of patients will have severe disease and will require oxygen and hospitalization, and 5% will require ICU care. Now, if you have had 1 lakh cases, you would say that the number was X. But if you have 2 lakh cases, the number becomes 2X. So in absolute numbers, we're seeing a larger number of people with lung involvement. But as a percentage, it's still the same. It's only that you're seeing more and more, because now our numbers have become so much. If we have 3 to 4 lakh cases a day, then the number of people who will have lung involvement will be much more than what we were seeing 6 months ago. And number of people who will require oxygen will become much more. So what I'm trying to say is, although the percentage may be the same, in absolute numbers, we're seeing so many patients who have lung involvement. But I would suggest this, that you don't need to get a lung scan done. You monitor yourself closely, and the most important thing to monitor is your saturation. If your saturation shows a fall, you must get a CT scan done and get your blood test done for inflammation.
You know, you said 3 to 4 lakhs, and there are experts, epidemiologists, who are also predicting that the numbers could go that high. Are you actually anticipating that India will go as high as 3 to 4 lakh cases a day?
So I don't want to to predict things, but what I would say is that things may get worse before they get better.
Things may get worse before they get better. I think that's well, that sounds very scary, but it is good advice for everyone to remember while they go about their daily business. We're going to slip into a very short break, but we'll talk a little more about younger people getting infected, including the efficacy of vaccines on the other side. Do stay tuned. Welcome back. We are in conversation with Dr. Guleria, answering all your questions on COVID. Dr. Guleria, a commonly asked question is, of course, younger people getting severe COVID-19 and when the vaccine will be made available to those below the age of 45. Do we have any timeline?
So you're right. We're seeing now that younger people are getting infection, and in some of them it's severe. We had seen that in the past also, but I think it looks a little bit more than what it was in the past in terms of younger people getting more severe infection. The younger age group definitely is getting more infected in terms of the absolute numbers. Whether that is translating to more severe infection in them proportionally is something that we need to see.
Yes.
Regarding the vaccine availability, I'm hopeful that now with a lot of opening up and vaccines from outside also being allowed to come inside and many other manufacturers being roped in to make the vaccines which are available in India, we should be able to get our vaccine doses to a sufficient amount that we could open it up to people under the age of 45. Sputnik V has also been now added to our armamentarium.
Yes.
Other companies are also manufacturing vaccines. So let's hope so. I'm not sure whether I can give you a definite timeline, but I'm hopeful that this will occur sooner than later.
Right. The other question is, as cases of reinfection continue to rise, what should second-time COVID patients be careful about?
So we need to first see what is the percentage of people who are having reinfection, because it's an important issue. The important issue is that means is the virus now, has the virus evolved and developed an immune escape mechanism? Because does that mean that people who had antibodies in their blood are still getting infection? So this is a group which we need to study more critically as to how are they, what is their antibody titer and what is the type of infection that they're getting. So that is why a lot of studies are being planned about looking at people who are getting reinfection. But I would like to just highlight two things. One is all of those who had infection in the past should get themselves vaccinated. They should not really think that since they've got COVID in the past, they don't need to be vaccinated. If they are in the priority group, please go ahead and get yourself vaccinated, because that will give you added sort of protection as far as COVID is concerned.
Dr. Guleria, are there any particular symptoms that a second-time COVID-infected patient should watch out for? Any particular markers or any particular tests that they should get done?
Symptoms are the same and the tests are the same, that you have to get your RT-PCR test done. And it's not that if you get reinfection, your symptoms will be different.
Okay.
They will be the similar as you had in the past. There are some studies which suggest that if you get reinfection, you may have a milder illness, but that again needs to be looked at more critically.
But can patients who have antibodies, now we know antibodies fade after a certain point in time, they don't last you forever, but can a patient who has antibodies test positive with the new strain of COVID? Is that possible?
So that's exactly what I'm saying, that we need to look at that, because if that is happening, that means the strain has developed what we call immune escape mechanism, and despite your immunity being there, you're still getting the infection and you're positive. You can be positive. So we must, there's another thing that's important to remember. Like I said, the difference between infection and disease. So if you have antibodies, either because of past infection or because of the vaccine, you may still have COVID and your RT-PCR may be positive, but you will not get severe disease. You may not go into the hospital, you will not require ICU care, but you may still be infectious. And if you have a strain which is highly infectious, you can give the infection to others in your immediate vicinity. Therefore, the vaccine and past infection will give you a milder disease, but it may not protect you from infection completely.
An allied question, because we are seeing people testing positive in clusters. There are entire families living together that are testing positive, neighborhoods, etc. One of the commonly asked questions is that the timeline may differ. So, one person may be RT-PCR positive on one day, the family member 5 days later. Can those people still continue to live together after their respective 14 days are over? Or can they infect one another again?
So if you have already got the infection and it's a cluster which got infection, but they became positive, let's say a few days apart. Then subsequently, it's not that you can reinfect someone else because you got the infection 5 days later, and now the person who got the infection 5 days before can get reinfected. That will not happen. You will all move as one cluster. But the point that you're making is something that we need to really understand, that this time the virus is infecting clusters. It's not affecting one or two individuals. You'll see whole families or whole people in a colony getting infected. That's one of the reasons why we're saying aerosol infection is important. And the second, that the virus has become highly infectious and is spreading quickly in among family members.
I have 30 seconds, but two quick questions. One is this double mutation in India. Are our Indian vaccines effective against it?
So the current data suggests that they would be effective. Their efficacy may come down to some extent. But like I said, we need more studies, and we need to have a sort of a very aggressive research program which keeps looking at vaccine efficacy and the new mutations which keep happening. This is not the final mutation that is going to happen. The virus will mutate in the near future. So we will need to continue to really look at both of this, and this is something that is being done. But I think we need to do it also at this research at a very aggressive manner.
Okay, very last question, Dr. Guleria, because there's such a mad scramble for drugs like Remdesivir, TOCILIZUMAB. When should these drugs be prescribed and to whom?
So it's very important to understand, firstly, that Remdesivir is not a drug which is shown to decrease mortality. It does not save lives. It decreases hospital admission. And it's only useful in a hospital setting when your oxygen saturation is falling, your lung picture is showing shadows which suggest that there is no viral replication occurring in the lung. And it has not been shown to be useful in mild patients or in the early disease. As a matter of fact, it may cause more side effects. Therefore, it's very important in treatment of COVID, both for Remdesivir, Tocilizumab and for steroids, that you know the exact timing of the drugs. Because if you give steroids too early, they actually cause more harm than good. Same goes for the other drugs. So I think it's important that we understand that drugs and the timing both are very important in the treatment of COVID-19.
Well, this is important advice for doctors treating COVID-19 patients as well as for relatives of patients who think that these are in fact life-saving drugs. They are indeed not, and you should only take them under medical advisement in a hospital setting. Dr. Guleria, thank you so much for sparing your time and being with us on NDTV and so patiently answering our questions. That's all we have time for. Thanks for watching.